Good morning. Welcome to another Sunday Conversation. We're out here at Valley Healthcare System in South Columbus. We're with Dr. Asante Hilts. She's the CEO of Valley Healthcare. Welcome, Asante.
Thank you for having me.
You and I go back a couple of years. You're what I call one of my COVID bright spots. You were working for the Department of Public Health when we first met, and I was struggling to understand what was going on with COVID, and I asked somebody in the mayor's office, I can't find anybody that can really explain what's going on locally. They said, you need to meet Asante Hilts. And from that point, I reached out to you, and I found that you were very helpful during that. And you've changed roles since then, though, right?
Yes. So when you met me, I was with the Department of Public Health, and I was with West Central Health District. And now I'm here at Valley Healthcare System, but still in public health.
In a very big way. Tell me a little bit about what Valley Healthcare System does.
Valley Healthcare System is unique to our community. We are actually the only community health center. So by definition, we're called an FQHC. That's a federally qualified health center. And what that does is allow us to bring comprehensive healthcare services to our community here in the Valley. So that's medical services, pediatrics, vision, dental, a full pharmacy, women's health, and outreach services, all under one roof.
And you serve the underserved part of this community. Part of what you do is to serve the underserved part of this community, right? In what way?
The goal of a federally qualified health center like us is to ensure that there's increased access to care. Because oftentimes you can have a center here, we can have multiple locations, but if people can't get to you and access those services, it's really a moot point. So our goal is to make sure that services are accessible to everybody, but really emphasize and focus on those people that traditionally can't get services for whatever reason, whether that be inability to pay, not having insurance, not having transportation. So we outreach to them. So providing transportation services, helping them get insurance, making sure that costs are low so that they can access the care.
Preventative care is so important. Why?
Preventative care is important because we want people to embrace wellness. We don't want people to come to us when they're already sick. So let's take vision, for example. That's one of our departments. We don't want people to come to us when they're nearing blindness, when their eyesight is so poor because they've been struggling with uncontrolled diabetes. We want to see them at a young age, watch their eyes, ensure that we're preventing illness. And so we're trying to help people understand that. Wellness overall. Come see a therapist and counseling in our behavioral health department before there's a traumatic experience so that you've already built a relationship with a therapist. Come and see us when you're not sick so that when you are sick or something's going wrong, we can catch it early. That's the point.
So you're trying to put people that may not have the financial means on par with people that are insured.
Absolutely.
And in treating health care and health issues the same way that somebody who's got an insurance card will treat them. That's a tough job, but it sounds like it's a very rewarding job. And when you look, Asante, do you keep people out of the emergency rooms at Piedmont, at St. Francis, and in what way?
So one of the foundations of public health is to help people before there's a major issue. So we want the emergency rooms like St. Francis, Piedmont, to really serve people who have a true emergency. We don't want people to utilize the emergency room because they do not have a medical home or because they haven't been able to access healthcare. So we exist so that people can come to us and keep those emergency rooms truly for real emergencies.
As you've transitioned into this new role this year, I think you started in January, didn't you?
Correct.
As you've transitioned into this new role, what in your past has helped you to do this? And what is your background in the medical field?
Sure. So I am an epidemiologist by training.
That's why you were so good in COVID.
Right. So that, like I said, the epidemics or pandemics are kind of what I specialize in. But at the foundation of that is public health and preventative medicine, prevention overall in the community. So that's my baseline coming into Valley Healthcare System is how do we ensure prevention? How do we reach out to people and ensure they understand nutrition and healthy lifestyle and finding a medical home that they can be watched during the time of their lifetime, having comprehensive services all in one place. So that foundation of public health is what I bring to Valley Healthcare System.
And has that allowed you to look at this? This is a long-standing organization that has been built literally from the ground up. Has it allowed you to come in and assess the organization, but also assess where you can go, what you can do to make it better?
Absolutely. And I've had a great time since I've transitioned over here because I feel like my public health experience is a valuable asset to Valley Healthcare. I have a great team. I work with some wonderful physicians and nurse practitioners and nurses and outreach staff. And we all have the same vision and goal for the community. How can we ensure that healthcare services are more accessible to people? So when you see us out in the community, you'll see our mobile unit. We have a dental mobile unit. We have a medical mobile unit. We do a lot of outreach. We really work with Hispanic families to ensure they have translation services so that we can get people to our clinic who may not have otherwise either known about us or had access to the clinic. So I'll give you another example. Transportation is a big barrier to healthcare. So we have a great transportation system here in Columbus, but people still struggle getting to a doctor's appointment. So what do is we have a fleet of vehicles that can transport people who have an appointment at Valley for free. If they come to us and they need to see a specialist, we will transport them to that specialty provider. So we try to eliminate that transportation barrier so people can get to us.
You're removing obstacles.
Absolutely.
You have been in Columbus for how long?
About 5 years now.
You're a native of New York?
I'm a native of New York.
So what, in 5 years, you've obviously formed some opinions of this community. What are they? What do you think of Columbus?
I love Columbus. And, people know my story. I have recruited a lot of family members to come down here to Columbus. My father-in-law, my mother-in-law, my mom, 2 brothers, 2 sister-in-laws, a cousin. And the reason why is...
You helped the census.
Yeah, I'm trying to help the census. And the reason why is because I feel like Columbus is a strong community. It's a great place to raise children. I have 3 girls. And, COVID helped this too for me to realize that the strategic partnerships, the community collaborators, people who are willing to join hands with you to really focus and work on a cause, it exists here in Columbus. And that's why I like it. I like the resources that are available as well.
This has always been, and I've covered it for years, a philanthropic town. Do you see that philanthropic effort in what you're doing?
Absolutely. I've seen it in multiple ways. We were just talking about the kickoff of the C3 collaborative with Skip Henderson, with our wonderful mayor, who I've worked very closely with, especially through the pandemic, is focusing on things like violence in our community and being very responsive and then being proactive to how we address those concerns. Again, that's one of those social determinants of health, not just your health care, but all the things that are impacting your health, like your environment. So that those philanthropic efforts help things like community collaborations to address violence, to address homelessness, to address all those things that impact health overall.
Is the violence, particularly the younger teenage kids that are killing each other, is that an epidemic?
Absolutely. And our response to that from a public health perspective is to respond to it like it's an epidemic. So even right now, under the mayor's approach, looking at Cure Violence, and Cure Violence utilizes Valley Healthcare System as another location here in South Columbus. How do we respond to violence as we would any other epidemic? How do we identify and target those who are going to be at highest risk and provide them with resources and try to isolate them and figure out what can we do to help them before that end result of violence happens?
Are you and this organization in a position to be part of the solution to this problem?
Absolutely.
In what way?
And that way is looking beyond just the person's medical needs. So in addition to those medical needs, what are the social needs? What are the housing needs, the employment needs, the insurance needs, transportation, the mental health needs? So I'm dealing with a family who may have been a victim of violence. How do you ensure there's no retaliation? How do we get them connected to a counselor and the other resources in Columbus, in this area, to keep them away from the violence that's happening around them? How do we respond to that is by looking holistically at the individual, not just medical, but all the things that will influence their outcome of healthcare.
What do you say to the mothers, many of them your age, who are having teenage boys and girls that are falling into this vicious trap of violence? What do you say to them about the help, about getting help?
My response to them and what I encourage them to do is to join hand with us. So not only are you dealing with having the parental responsibility, but how do you join hand with us who are in healthcare, who are in employment, who are in job readiness and training, so that we can make those resources available to your children and to your family. so we can respond to the violence that's happening.
We're getting near the end of this, but I want to ask you one thing. As somebody who has clearly adopted Columbus and brought her whole family with her almost, you see the challenges in our community as well. What's the biggest challenge we face as a community?
I think the biggest challenge that we face here in Columbus is ensuring that we don't work in silos, that we come together, because I see Columbus as a very resource-rich community. But if we operate very separated and in silos, we can never truly leverage all of those resources together. So the biggest challenge is, how do we do that? How do we ensure that we're not just having these separate entities, but we come together as a whole? Because each one of us brings a piece of that puzzle. We might bring healthcare, someone else brings employment, someone else brings rehabilitation, behavioral health, all those things coming together. If we can truly work together, then we're much stronger than to get together as we are apart.
That is a perfect way to end this, Dr. Hilts. Asante, I can't wait to see what you do in this role. I think you are going to be somebody in position to make a difference in our community. Thank you for being here.
Thank you so much.
You've been watching another Sunday Conversation. Our guest has been Dr. Asante Hilts. She's the CEO of Valley Healthcare System. Come back again next week. No telling where we'll be or who will be in that chair.